This podcast is sponsored by CSMI, the maker of the HUMAC Norm isokinetic system. Purchase a new or refurbished machine, or you can even upgrade an existing system to bring it up to date with all the latest testing and training applications. Please visit csmisolutions.com to view all of their available products, including the HUMAC Norm isokinetic system, the HUMAC Balance portable computerized balance system, and Sportswear Online. CSMI. Better data leads to better results.
The Everything PT podcast is sponsored by Vald Performance. Vald is the creator of the airbands for blood flow restriction therapy. If you are looking to stay up to date with today's post-surgical modalities and adding BFR to your clinic, please visit valdperformance.com. Hello, and welcome to the Everything PT podcast with Matt Taylor and Daniel Bodkin. Please do not consider anything you hear to be medical advice. Just a couple of guys ranting about everything PT. Enjoy the show.
Welcome back to the Everything PT podcast. I'm Daniel. There's Matt. Welcome to the show.
What's up, guys? Daniel, how you doing, man?
I'm healthy.
Yeah, I sound like a walrus right now, probably, but toughing it out. You know, we had to reschedule all of our patients today, but all good. Yeah.
So it's good because I was under the weather last week. So
yeah, man, the flu A is going around pretty harshly in southern West Virginia right now, I guess. So
yeah. Well, I got the 3.5 and almost 4-year-old and a 5-year-old now. They bring everything home. So you ultimately get all of it. But since you're under the weather, and we did have a guest who was supposed to be on today, but they couldn't show, I figured give us a chance to talk about stuff. And like, I need an excuse to talk. If it's something I can talk about, you can rest your voice a little bit. So we were kind of brainstorming. And so we kind of thought about a good topic.
Yeah. We could just talk about a little bit of academia and your path and how you came to get into it, Daniel. So why don't you start us off here, brother?
So I'm in my last week of teaching for this semester, and they're actually closing down the program that I'm teaching. It's an athletic training transition to master's program, and it's online. And they just recently consolidated athletic training under physical therapy. And I don't know, who, why, or what, but I think they're just kind of trimming the fat with it. And they decided they're going to close down that program. So, I don't know. Am I going to teach in the future? Am I going to get a floater job? I need to do something during the day to tell my wife that I do, so she doesn't make me get a real job. But so, all right, when I was graduating, I was working for John Hisamoto in Tampa, and I was working for him part-time through PT school. Now, he's really close with another physical therapist, Dr. Mary Blackington, and she was starting the Nova Southeastern hybrid DPT program in Tampa. And what that was is it was, now it's kind of, other people have done it, but at the time it was really cutting edge. It was students from all over the U.S. And they would have all their schooling was all online. Their lectures, their homework, they would film themselves doing some of their special tests, some of their manual techniques, and then they would send it to the professor. The professor would give feedback. So there's it was all virtual, but 1 week a month. I think it was like Thursday through Sunday, the students had to come to Tampa. And this is when they would get any of their hands-on. This is when they would do all their hands-on exams. So they were just starting that program, and they were looking for lab instructors. And Mary went to school with John. So she asked John to do it, and John's like, I'm too busy. I got too much going on. So, he recommended that I do it. So I was maybe a month out of graduating PT school, and I was like, yeah, I'll do it. So I got hired to take PT students and occupational therapy students. And they would, we went to a cadaver lab, which was just across the bay in Clearwater. There was a school there that had a chiropractor program, and they already had pre-dissected, I guess it was cadavers in various states of dissection. And so we'd basically show up at 8 o'clock in the morning, and each I bring, a small group, maybe like 30 students at a time. And we'd spend 2 hours, and I'd go through whatever the structures that they needed to know for that section. It was nice. We didn't have to do any of the dissection. If you've spent time actually dissecting out, the most of the time you spend is cutting into it. This was nice because you'd have some, very fresh cadavers, but you also had some that were completely dissected already. So I would show them the things they needed to know. Here's the, here are the ligaments. This is, I remember it was always cool when I took them through the neural tension tests, and you could actually see each band of, which nerve gets taut in which position. So I'd show them that stuff, or I'd show them how the fibers of a muscle, move and, can bias motion. The anatomist there was really good. He would go ahead and cut an ACL for me on one side. So we'd show, what a Lockman looked like on a healthy knee, a cadaver knee, but then we'd do it on the opposite side with it being cut. So I would show them a lot of the hands-on things that they were learning in the classroom, but on the cadaver. So it was really cool. I kind of gave them, I called it a functional cadaver approach. So I did that. Gosh, this is 2012. I left there in 2016. I did it all those years. And then that second year, I got invited to come and be a lab instructor for a palpations course. And with that, I'd show up with the students and, kind of go over a lot of palpations. And then on the weekend, we would do an exam. So I'd help grade their palpations exam. We'd list off, 20 different things, and they'd have to palpate it, but they'd also have to activate the muscle or, stretch, something to really identify where they were.
Mm-hmm.
So I did those while I was in Tampa. And then right before I left Tampa, I was approached by University of South Florida's athletic training program.
Go Bulls.
Yeah, go Bulls. That's right. We only lost by 7 to our rival UCF. When I was there, we would win by like 40, 50 points.
Of course.
But we only lost by 7, so that's not bad. Just like my Colts last night on Monday Night Football, they only lost by 7.
Michigan upset Ohio State.
Crazy. Lots going on. Just my teams, that's neither here nor there. Nonetheless,
Sorry.
USF was on the Blackboard system, and they were changing over to Canvas. It's just a different, hosting platform. And they asked if I would take one of their classes. It was a rehab class, and just transition everything over, copy everything over. So I did that for them. And then she's like, you know what? Would you be interested in just teaching the class? And I was like, you know what? Absolutely. It's a rehab class. It's for athletic trainers who are already out practicing. And, they're getting that transition to the master's degree. And I kind of took a lot of the things that I learned at the hybrid DPT program for Nova Southeastern. So I kind of threw some of those elements in. So I taught that since 2014, and that's the course that we're finishing up this week. So then I also got asked to be the adjunct professor for, it's an administration of injury prevention programs, just another semester. So I think I've done that for 3 or 4 years now. It's always, heavy front loaded when I start it, because I'd either, create the program, or every year I'd go through and say, okay, what can we improve? So like last year I added a whole BFR section into their strengthening.
Nice.
Or I realized, hey, we don't have concussion in here. And this is kind of like an advanced rehab class for athletic trainers. Why don't we have concussion? So I made a concussion module. When you add something somewhere, you got to take something from elsewhere. So every year it'd always be kind of like front loaded. But then after that, it's actually not that bad, because then you're just going through, you're grading their quizzes. And my quizzes, I made them all, not all, but a lot of it's very essay based. So there's no real one right answer or wrong answer. It's just more tell me in kind of scenario case based. So a lot of times I'll ask a question. Like one of their questions had to do with the athletic director and the principal at a high school asked you to create a return to the classroom concussion protocol. And most of them picked up on that because I always have something, in their readings or their literature to help them formulate their answer. Most of them got it right, but a couple of them gave me a return to sport answer. And it's like, while this answer is great, the question is really looking for a return to the classroom. So, I always grade and then, give them feedback, and then they have a chance to change their answer if they choose to get more points. So, there is some work that I do during the week. I also have a lot of discussion boards, but I try to make their discussion boards, demonstrations. So here, demonstrate proprioception exercise. And I always say, don't just come with something simple like standing on one foot. Make it, something sport specific or something that, you learned, because it's a chance for them to learn from each other.
Sure.
So I try to incorporate a lot of those elements because it is, virtual. And currently have somebody who's in Canada. A couple of years ago, I had a student that was in Japan. So they can't be in the same location. A lot of them are at USF, but a lot of them are remote. So it's, I try to, make it engaging.
Yeah. So real quick comment and question. I think that's what COVID did for us. I think it sped us up probably 10 to 20 years. And, we had that much growth within the last couple of years. So we have the opportunity to be with people around the world now. And I had a follow-up question for you, Daniel. Do you feel like the data, the doctor of athletic training, in the field going to that has kind of maybe had a hand in eliminating that master's program you were teaching in?
I'm not sure. So I think it really went there because athletic training is going to an entry-level master's. And this program, like others just like it, are for those who have a bachelor's degree who want to get it in master's. So before this, if you wanted a master's degree as an athletic trainer, you would typically do an internship at the university. You'd work with the football team, the soccer team, but you were working with that team while you were getting a degree, and it was usually exercise science. And so they were getting the master's degree, but it wasn't in athletic training per se. So this program, it's actually athletic training, and it's the focus is on pediatric, so middle school, high school, or even younger. Versus, in athletic training, a lot of times you're only working with the college sports teams. I had the chance to do 2 rotations at a high school. So I got a lot of that pediatric aspect, and it wasn't just a high school, but it was a middle school as well.
Sure.
So a lot of the athletic trainers, unless they've done those rotations, don't really learn a lot of the pediatric specific injuries or considerations. So that's what the focus of this program is it's actually rehab considerations for children.
Very cool. I did have a question, but it escapes me now.
So really the thing is I never thought that I would go into teaching. If you haven't heard me say it before, I'm a meathead with a degree, right? And a lot of people might feel like that as well, like, teaching's not for me. But after getting an adjunct position, I came to find out I really enjoy teaching, giving to, the next, the athletic trainers or PTs coming up after me. So would I ever see myself being like an associate or an assistant, like a full-time professor? Probably not. I like the kind of like the side gig or the side hustle being the adjunct. And it's a great way to get into the education side.
Yeah, I just remember my thoughts. Sorry, my brain's not working at all cylinders yet. I'm not feeling good. But Daniel, so you've been a clinician, full-time. You've been in the private sector, with personal training and with PT, after ACL, and you do a little bit of academia and education. So what are some advantages and disadvantages of academia that if someone is interested into getting into it, you think?
One, it really keeps you on your toes because people will ask you, questions, this or that. And it's one thing to just, know why I'm doing something. It's completely different when somebody's asking you to explain it to them. Or so there's always a couple students that'll kind of challenge you to kind of stay on your toes. The other thing too, it's like you don't know what you don't know until you have to try to explain it to other people. So
Sure.
it really kind of really helped me, I think, find my voice, because when you can, have that side, then it's really easy to talk to patients. One of the big things I have in this course is making the students explain very complex things to students or parents. Just this last one, we were covering the spine, and a parent comes to you and they have a concern about their daughter's scoliosis. How do you explain it to them by keeping it dumbed down? Not dumbed down, but
Look out.
terms. Another one, we just covered concussion, and so as a high school sophomore suffers a concussion, they're still having issues, with balance, nausea. So explain to them the vestibular ocular reflex, the inner ear, and its role in concussion, which is very sciencey. And a lot of them, try to give me the very sciencey answer. And it's like, but you're explaining it to a high school sophomore.
Right.
So, and so I really try to incorporate that, because all the time a patient or a parent will ask you a question. And, even just saying little things like calling it a shoulder blade instead of a scapula, little things like that, don't overcomplicate it, but get your point across at the same or across at the same time. I really think that has helped me as a clinician. Again, if I wanted to go more into academia, this would be a good place for me to start. And we even had somebody that you were familiar with on the show. She was from FranU.
Oh yeah, Kelly Rodriguez.
Yeah, go back and listen to that, because she was the same way. She started out as adjunct and found out she really enjoyed adjunct, and then she got into academia full time because of her experience as adjunct. And I'd say, it's hard to get into it if you don't have a program near you.
Sure.
But let's say you're in a town or a city and there is a DPT or an athletic training program, go ahead and approach them. Say, let them know, if you need help, let me know how I can help you, whether it's coming in and just doing a single lecture. Lots of times that's kind of how it starts. Or if you need somebody to be a lab assistant, you just kind of start there, pay your dues, start getting helped out, see if it's something you like. And then, maybe getting a full adjunct position. Then maybe you're in charge of a course. It's a good way of kind of getting your feet wet, deciding if it's something you really enjoy doing, versus never going into that and saying, what, I think I want to get my, doctorate and start teaching, because you might not like it as much as you think.
Yeah. We've had a few students here in the private setting, and that's some of the thinking back, that's some of the most valuable learning time for me, when I am actively teaching someone or explaining my situation, why I'm doing this, why am I justifying this intervention. Something else you mentioned was dumbing things down, like on a fourth grade level. Do you ever listen to Joe Rogan on there? All right. He's had Elon Musk on there a few times, and fascinating interviews, but Elon, Joe will ask him really hard questions, and then Elon will take some time. Like, it seems like it's a long time, but really it's 4 to 5 seconds. And what he's doing is he's thinking of an analogy to dumb down a very, very complex thing into very, very simple terms. And that's a sign of someone who's very, very intelligent. And that's hard to do, because you really have to have a great control and command of the evidence and science and the information so.
One of the things that was hard for me was, like I said, I have a lot of, I've changed a lot of my questions on like quizzes or exams to be open. I give a case, a scenario, and then you tell me what you would do. It was really hard for me early on to not grade it as, well, this is what I would do, and be a little bit more open to other people. There are ways, there's so many ways you can approach rehab. So that was initially a little bit difficult for me. And then over the years, I came to not just, I want to think of that I'm being more lenient, but it's just more, I'm open-minded to other ways of doing it.
Yeah. Yeah. If science has told us one thing, it's that we don't know as much as we once thought that we did, and question everything. So,
I mean, let's be honest. In rehab, you can do, and it shows doing anything.
Yeah.
Can sometimes get people better.
Especially with back pain.
Yes. Back and knee pain.
Back.
Yeah. Work your shoulder. Your knees get better. It's weird.
Very true.
So yeah, that's been my experience. And I've decided, or I've thought about, because there is a local university right near where I live, and they have an exercise science program. And I thought about approaching them. Do I go in and see if they need any help, or?
Well, just thinking about some of the best teachers that I've had, they're expert communicators. They really know their subject matter very, very well. I think you would be great at it if you wanted to in the future. Just being a part of the podcast and communicating so well, interviewing people. So it's more than half the battle, I think.
You mentioned something off air about needing to have a certain degree for teaching. What is that?
Oh yeah, I think we interviewed. Well, it hasn't come out yet.
Yeah,
but I've talked with a friend of mine who's a director at a local university, and I think he said you have to have an EED or some sort of PhD in order to be like a full-time educator, and that really holds a lot of people back, because and I get it, because I can see it. The numbers, therapy school is expensive. You're in debt, and then let's go into more debt, and just to not make a ton of more money. So you really need to love it. It sounds like.
Yeah. And, I don't think I'm ready to dive into the water. I like being able to, dip my foot in a little bit as an adjunct, but keeping, clinic, all the other things that I do. Even before I ventured out on my own, when I was just working in a clinic, it was always a nice little side hustle, not just money wise, but it was nice to have work that was separate from my normal caseload and patients. It was something I would do in the evenings when I got home, or on the weekend, or sometimes even during my lunch hour. It was kind of nice because it was still work, but it didn't feel like just, in the PT mill. And
so I did get some interesting information from a friend of mine, Dan McGovern. Hey there, Dan, if you're listening. But he has a sports, the SCS through the APTA, and that enables you to teach sports within a program, I believe, too. So so I'm learning a lot about that. So that might be something to look into, and that might enable us to teach at a really basic level.
Oh yeah. So yeah, if anybody's interested, you can certainly contact me. But lots of times the people that you learn from while you were in PT or athletic training, they were adjuncts as well. So you can always contact them, because they're probably going to be the experts on your local area, and who to contact, and how to get involved. So I say, yeah, you can certainly contact me, but I've kind of already told you my story. But contact the people who were the lab instructors where you went to school, or even just the professors. If you still live in the city where you went to school, get a hold of your program, ask what they need help with. You may have, created a little niche of your own, or specialized, like you with lymphedema. That'd be perfect for you to kind of help a program out if you had that. Or if you've taken, some McKinsey courses and you're McKinsey certified, or if you're specialized in the pelvic floor, whatever it is, if you've kind of developed, your practice and kind of gotten a specialization, well, lots of times your program that you came from might benefit from having you help out with, even if it's just for that section. But that's a way that you can get started.
Yeah. And it's always good to network and want to give back to the profession too. And I think, when you scratch, the university's back there inclined to scratch yours with student placement. And that's a great way for employers to get employees in the future too. So I think it's kind of a mutual giving too.
Certainly. All right. Well, Matt, anything else?
I think that's it. But it might be I think people should think of it more often whenever they are considering their career choice within our field. And because we're going to need more educators in the future for sure. And there's a lack of them, it sounds like right now.
Yeah, certainly. But what I like the most is you're coming from a clinical background.
Mhm.
So you might even, go, treat from 8 until noon. And then after, lunch, you go and you teach at the university for a couple hours that day. So you're bringing fresh, perspective on patient care.
Mhm.
So I think that's cool because you're learning from somebody who like literally was just doing it an hour ago.
Yeah, very true.
So
I think that's all I got for you today,
yeah,
Dan.
not bad for trying to figure out what we're gonna do just before.
Yeah.
Well, my friend, I hope you feel better, and
Yeah. I will.
we'll see you guys all next week.
I apologize for the awful voice today and dreariness on my face, but yeah, I'm glad to get it in, and we'll catch up with you guys next week. Thanks, Dan.
Bye. Looking for a way to improve sport-specific training with your athletes? Then you have to check out Blaze Pods. Blaze Pods is a neurocognitive reaction training intervention that can be incorporated into your sessions for patients throughout the treatment spectrum. Visit blazepod.com, enter code EVERYTHINGPT at checkout, and save 15% off your order today. Hey, all you rehab specialists out there, do you have an isokinetic dynamometer just sitting around your clinic not being used? Little known fact, isokinetic machines that aren't used regularly are at higher risk for bouts of sadness. Help your machine out and take CSMI's newest CEU course, Isokinetics 101 online, created by me, Daniel Bodkin, and learn how to use all the exercise and testing applications available on your machine. With new and exciting rehab techniques in your toolbox, your sad isokinetic machine can become an active member of the rehab team again and regain its happiness. Isokinetics 101 online by CSMI has been approved for 8 credit hours for athletic trainers, physical therapists, and physical therapy assistants. Contact your state board for details on specific requirements. This course is available at humacnorm.com/courses/isokinetics-101.